Communicating at a Distance, Isolation's Impact on Verbal and Nonverbal Skills. For the first time in human history, we learn, teach, work, socialize, and entertain in front of the same screen. Paper et al., 2021. As we are all well aware, COVID-19 is an ongoing global pandemic that has affected every industry and individual in one way or another. As a result of this pandemic, we have all needed to become very adaptable to follow the necessary precautions and regulations for the safety of ourselves and others. With these new societal expectations also came many changes that needed to be made in order to reestablish ourselves and create a new sense of normalcy. During our time in isolation, we discovered ways to adapt our communication and interactions. These changes were both good and bad. Some will continue to be integrated in our lives post-pandemic, while others will be left behind as artifacts of this historic period. I'm at an age now where I am able to experience the pandemic from an interesting perspective. I'm currently a senior in college, so I'm old enough to fully understand the severity and impacts that the pandemic has had on a global level, and be able to experience firsthand how an industry, the education system, handled the rapid transformation to a completely online platform. In this presentation, I will be examining the impact that isolating events such as COVID-19 have on individuals' verbal and nonverbal abilities. I will be utilizing recently published sources about COVID-19 and data from prior isolating events to support my thesis and make predictions for a post-pandemic environment.
By understanding the impact that prolonged isolation has on individuals, we can design a strategic plan to help minimize the resulting negative effects in case of another mandatory quarantine. To break down this topic, I have organized my research into the following sections: how communicating at a distance impacts our communication, the alterations and adaptations that companies have taken, the effects of isolation on the different age groups, and post-pandemic expectations. All of these factors play a pivotal role in an individual's ability to adapt to life during and post-isolating events. We will first examine the impact that increased electronically mediated communication has on our verbal and nonverbal competence. As a result of stay-at-home orders and self-isolation, people quickly became familiar with video conferencing through sites like Google Teams and Zoom. Many industries utilize video calls to compensate for the lack of face-to-face interactions. While we have gotten very accustomed to the use of video conferencing, it's interesting to note that, quote, while only 10 million people attended meetings on Zoom at the end of 2019, before the coronavirus was widespread, by April of 2020, usage had exploded to 300 million, Witterhold 2020. With this increased use of video conferencing platforms, the term Zoom fatigue has emerged. Zoom fatigue describes the feelings that many experience after a Zoom call. Many claim that video conferencing leaves them feeling tired and emotionally drained, unlike other interactions. As this is very much a new phenomenon, there is new research coming out every day, although the theories that are currently out are extraordinarily intriguing. Jeremy Bailenson is the Courtesy Professor at Stanford University and the Director of Stanford's Virtual Human Interactions Lab. In a 2020 article by Bailenson entitled Nonverbal Overload, a Theoretical Argument for the Causes of Zoom Fatigue, Bailenson explained why video calls seem to be much more emotionally draining than other types of interpersonal interactions. From his research, it seems that a majority of the fatigue comes from an overcompensation of nonverbal cues, like prolonged eye contact and exaggerated micro-expressions. This is because they are harder to pick up on when not meeting face-to-face. In order to fulfill this requirement through an online medium, our brains must try to put in more effort to send and receive these messages. So, we're trying to adapt to these changes by explicitly trying to replicate the things that we were once able to do so easily in person. This overcompensation and increased effort needs to take place, but it eventually takes a toll on us after a while as we try to re-establish synchrony. What I found most interesting about Bailenson's research, though, revolves around proxemics. In general, but specifically before the implementation of the 6 feet apart rule, people typically and often followed the rules of proxemics, which delegated the appropriate distance that one would abide by when interacting with people. In Bailenson's words, quote, Hall's foundational work on personal space from 1966 stated that anything below about 60 centimeters is classified as intimate. Based on Bailenson's research, Zoom places you at an equivalent of 50 centimeters from other users, thus violating Hall's level of what would be spatially appropriate for strangers. While you feel closer to your work and classroom acquaintances, this doesn't mean that you're more likely to have people interact with each other. The reason for this, according to a 2021 Pieper et al. Article, is that, quote, in large groups, just like in large lectures, Zooms tend to inhibit the process because it delays social feedback since people mute their microphones to avoid extraneous noise. On top of that, video calls add an extra barrier that users have to invoke in order to participate at the level that they would in a normal in-person classroom setting. Classroom etiquette has always required one to raise their hand and be called on before speaking. This formality has been made a function on Zoom as well, although there is now a second barrier of having to unmute yourself to make your comments and then remember to remute yourself once you're done making your point. Now that we've discussed how the increase in electronically mediated communication has impacted our verbal and nonverbal competence, we will examine how companies have altered their practices to accommodate COVID-19 protocol. As our country began to take COVID-19 more seriously, many companies moved their workers home to abide by safe-at-home orders and in attempts to slow the spread of the virus. To be able to continue conducting business, they also utilized different platforms to facilitate meetings and make up for the lack of face-to-face interactions. Although video conferences have allowed us to regain a bit of normalcy by letting us see the faces of our coworkers, there are certainly disadvantages to the program as well. In a 2020 article by Betsy Morris, a senior writer for the Wall Street Journal, entitled "Why Does Zoom Exhaust You? Science Has the Answer," references the work of Dr. Bailenson and Dr. Harrison when speaking about how Zoom disrupts conference room etiquette. In the article, Morris states that, quote, "Zoom has replaced the conference table, which has scrambled the office pecking order. Zoom says the order of the grid is first come, first served, depending on when people join with their videos turned on. If a user turns off their video, he or she goes to the end of the line." Morris, 2020. Then, of course, once you start getting used to having your regular video calls, you start to experience Zoom fatigue, which we talked about on the last slide. While it can be a challenge to adapt to living in a more virtual world, and there is a lot of research right now on the impact of extensive use, there is one facet of the pandemic that has been severely underreported. The facet that I'm referring to is that of economic inequality, which impacts a person's ability to properly work in a distance environment. While many people unfortunately were let go from their employment due to the pandemic, there were certainly individuals who did not have the means to continue their positions from home. An article by Drs. Chu, Jackson, and Kamdar on Website Manner discusses the challenges with conducting medical visits through phone and video calls, and the necessary changes that affected how doctors showcased bedside manner through different devices. Through all of the sources that I analyzed for this project, this article was the only one that made a point to mention, quote, "Social, economic, and demographic barriers to virtual care do exist." Chu, Jackson, and Kamdar, 2020. In their article, they explained how not only did some patients not have easy access to phones or video-capable devices or even reliable internet connection, but there were also older patients that did not understand how to utilize these different mediums, creating many challenges for their team to overcome. While this particular article focused on the medical aspect, these challenges still applied to other industries that had to be pushed online. We've certainly seen professors and students struggle with this over the past year. After learning a little bit about how companies altered their practices to abide by safety protocols, we will now explore the effect that isolation has on the different age demographics. As seen in previous public health crises, the COVID-19 pandemic is predicted to have short and long-term adverse mental health consequences among the general population, including increases in loneliness, anxiety, and depression. Gurenko, 2020. With stay-at-home orders, adults working from home, schools administering at-home learning, and limited availability to enter certain establishments, the coronavirus significantly impacted and restricted our abilities to leave our quarantined locations. This confinement took its toll in different ways for everyone, and certainly affected age groups differently. Of course, many families struggled to reestablish an appropriate work-life balance, but the two age groups that were affected the most were likely young children and elderly adults. For school-aged children, isolation certainly took its toll, as they were removed from their learning environments and forced to attempt to learn in areas with much more distractions on a medium that many were not familiar with. These youths also missed out on their ability to socialize with their classmates, which impacted their emotional well-being. When researching the impact that isolating events have on children, I found an amazing 2013 article by Sprang and Silman entitled "Post-Traumatic Stress Disorder in Parents and Youths After Health-Related Disasters." In their article, Sprang and Silman talked about the impact of the H1N1 virus, but I believe that their findings showcase the outcome that we should expect for post-coronavirus. Sprang and Silman stated that, quote, During the 2009 H1N1 pandemic in the United States, Mexico, and Canada revealed that more than one-third of children experienced clinically significant PTSD symptoms associated with social distancing and quarantines, end quote. Of those, quote, 33.4% began using mental health services either during or after the pandemic as a result of their experiences. Sprang and Silman, 2013. The pandemic was difficult for elderly individuals as well, as many assisted living facilities wouldn't let their tenants leave their premises nor let family come to visit them. This, of course, increased elderly individuals' feelings of isolation and loneliness as they felt confined within their facilities. This is an unfortunate thought as, quote, before the pandemic, national studies reported 1 in 4 older adults were socially isolated and more than 40% experienced loneliness. This is according to a 2020 Cujo and Cotwell study. Unsurprisingly, prolonged feelings of loneliness have an impact on one's health. Based on information from a 2020 Gurenko et al. Study, quote, among elderly adults, social isolation and loneliness are associated with increased reactivity to stressors, anxiety, depression, cognitive decline, negative health outcomes, and mortality risks, end quote. Because elderly people are also at a higher risk for the coronavirus, it's important that they and the people around them wear masks, although this can cause some complications as well. Wearing a mask makes it hard to detect nonverbal facial expressions, or microexpressions, as a majority of the face is covered. This means that we must rely on our ability to show and detect emotions based on others' eyes, which requires us to be more cognizant of our own nonverbal actions and is significantly more difficult to interpret on others. Now that we have a better understanding of how isolation impacts different age demographics, we will now examine the expectations that researchers have about life post-pandemic. At this point, I'm sure we've all fantasized about the world returning to normal, but in all actuality, there are likely a few things that have been permanently changed as a result of the pandemic. Based on the sources that I've examined throughout the creation of this presentation, I've identified 3 areas that I believe will forever be changed as a result of the pandemic. These include video calls, greetings, and the education system. Interestingly enough, the research that is out right now about video communications is rather contradictory. In many articles on nonverbal overload, the authors suggest to hide yourself from your camera and to be cautious of overindulging in video calls when other mediums are also appropriate. Although other studies advocate that you have your camera on and at eye level to maximize your attention and allow you to feel present, stating that feeling involved reduces feelings of loneliness. Regardless of where you stand on the subject, it seems that video calls are here to stay, and companies have refined their use of video conferencing sites to save people a drive to the office. This sentiment is supported by a claim in the 2021 Pepper et al. Study, claiming, quote, most likely, synchronous and asynchronous video interviews will be a part of the first automatic screening level to assess candidates for a job. There are even companies that are developing software to make virtual meetings more realistic. An example of this is the startup company Spatial, quote, that recently released a program that enables people to meet through augmented or virtual reality, allowing users to use headsets from a variety of brands to meet up in a virtual conference room. Witterhold, 2020. Through this application, users can have realistic virtual face-to-face interactions, greet each other, and, while the greeting won't always be online, we can assume that there will continue to be a lack of physical contact in greetings for a while, as people slowly readjust themselves to in-person interactions once again. My last prediction for life post-pandemic revolves around education. In the 2021 Pepper et al. Article, they used the term edutaining, meaning the expectations placed on teachers during the pandemic to deliver their lesson plans in an entertaining and captivating way while still being educational. I believe that teachers will need to continue to use new tactics to maintain students' focus as they begin to reintegrate them into full-time students again. While teachers already have to plan their lessons in an entertaining way, students have become accustomed to being at home and having access to distractions all around them. For this reason, I think that it will be difficult at first for teachers to keep their students focused for in-person classes, especially for lower level education, where the students take multiple courses back to back. In conclusion, today we discussed the impact that prolonged isolation has on individuals, and how understanding these effects can help us design a strategic plan to help minimize the resulting negative effects in case of another mandatory quarantine. We also broke down the impact that isolation has on verbal and nonverbal skills by discussing how communicating at a distance impacts communication, the alterations and adaptations that companies have taken, effects of isolation on different age groups, and what we can expect will stick around post-pandemic. Remember, the pandemic affected everyone in one way or another, so use your verbal and nonverbal actions to share in solidarity as we are all learning to readapt to a world post-pandemic.